News this morning. If your daily routine includes those little guys right there, and you put them in your ears after the shower, you start cleaning your ears, you need to stop doing that right now. People use all kinds of things to clean their ears. Hairpins, people said they use pencils, pen caps, cotton swabs, keys, long fingernails. Basically, we're not supposed to put anything bigger in our ear than our elbow, from what I hear. So, updated clinical guidelines published in the medical journal that focuses on the head and neck, and surgeries say that those small little items that you use, they're not appropriate for earwax removal. So Dr. Kristen Woodward is here to explain why. And it's quite the conversation starter because we all have these. You know, if you have little kids, you get in there and you clean it, but you're saying we're not supposed to do that.
We're not. We're just supposed to leave the ear canal alone. When you're washing your ear, you just want to wash the outside of the ear. It gets cleaned naturally by the earwax, which is a barrier. You don't want to be trying to dig in there and try to get the earwax out because the earwax protects the ear, and we can cause more damage than good. The problem is using these little tiny tools.
Like Q-tips,
yep.
You know, and bobby pins. What's going on when we get in there?
So when we get into the ear canal, you can cause cuts and scrapes in the ear canal. That can lead to bleeding and infection. You can actually rupture the eardrum. And then we've even seen people cause damage to these little tiny delicate bones, which are very essential in our hearing.
And do these affect our balance as well?
Absolutely.
If we do something.
Absolutely.
So Q-tips we recognize, obviously. These are like weird little toothpicks. What are these things? I have tried these, believe it or not, years ago. You light these bad boys on fire. You stick them in your ear, and what it's supposed to do? What's going on?
So this is called ear candling, and you put the narrow end in the ear.
Yeah.
You light the outside of the candle,
like
and the heat is supposed to travel down the candle and cause a suction to get the earwax out.
Makes perfect sense, Doc.
We do not recommend these for cleaning the ear out. We can see burns. We can see the eardrum rupture again. The wax from the candle can drip into the ear canal. It can be extremely painful and hard to get out.
See, where were you years ago when I tried that? Obviously, for me, it did not work. So what are we supposed to do, and how do we clean it? Do we come to a professional, a doctor, to do this?
So again, your ear cleans itself. If you want to clean the outside of the ear with a washcloth, that's completely fine. Now, there are some folks who have trouble with way too much wax in their ear. It's called impaction. If that's the case, you want to go to your doctor, and they'll use surgical tools to delicately clean the wax out. Now, there are some symptoms of too much wax in the ear. The symptoms are itching, ear fullness, pain, problems hearing. But before you go to the store and buy a bunch of over-the-counter treatments, you want to make sure you see your doctor because there can be other things that cause these symptoms as well. And
you said the ear, what did you call it? Ear with too much wax?
Impaction.
Impaction. What is that?
That's when the wax...
We've used too many of those and we've pushed it all the way in?
That's one of the problems, is that we're sticking things in our ear and we're causing the wax to get deep down into the ear canal, and it can actually cover the eardrum, which is how we hear.
Okay. What is the point of earwax?
The earwax cleans the ear. It's a barrier. Think of it like your eyelashes that protect your eye. The earwax cleans the ear. It protects from dirt and debris from getting in.
But with little kids, parents, we've had to clean our kids' ears because you actually see it like coming out.
Well, that's fine if it's coming out. You can clean the outside of the ear. Now, if you have a child who needs to see their doctor because you're worried about an ear infection, the doctor will take care of cleaning that wax out for you.
Interesting. Well, those little tools, I think we've all done it, you know. All right, thank you, Dr. Kristen. It's good to know. It's a topic. It's kind of gross, but it's important.
It's important.
We need our hearing.
Wax
we definitely
is good.
Mix it. We miss it when it's gone. All right, Greg, so now you know the details. We're not supposed to be cleaning our ears with Q-tips.
Yeah, well, now we do